6:25 in health news this morning. Another plus for breastfeeding. Japanese researchers looked at data for more than 80,000 infants and found those who were breastfed in their first 6 months had lower rates of insufficient sleep when compared to babies fed only formula. There were also some improvements with a mix of breast milk and formula. The WHO recommends exclusive breastfeeding for the first 6 months of life. What's happening in the brain may be reflected on the skin. In a study of adults, Brazilian scientists found a correlation between mental health issues like anxiety, depression, and stress, and skin conditions like inflammation and lesions. The findings show women are more likely to be affected than men. And there's some evidence artificial intelligence may help doctors treat patients more efficiently. A University of Birmingham study in Kenya tracked thousands of primary care cases where some doctors used a generative AI assistant and others did not. They found no real difference in short-term treatment outcomes for patients, but the AI-supported group had improved record keeping and lower antibiotic-related costs. A warning for parents this morning. Doctors say it involves something that many families already have in their medicine cabinet. Uba Ali explains the trend sending teens to the hospital.
The warning is everywhere, from doctors to parents scrolling the same social media apps their children use. Potentially deadly TikTok challenge is back, and experts are trying to get ahead of it.
Our goal here at Children's Minnesota is if a trend causes any sort of physical harm or mental harm, to make sure that we're taking care of our patients.
The Benadryl challenge involves these over-the-counter pills. Teens take large amounts of it and record themselves as the effects kick in. The trend first gained attention in 2020. That year, the Minnesota Department of Health reported 184 cases tied to intentional misuse. Cases continued to rise, but dipped in 2024 before more than doubling last year with nearly 400 cases. Most of the cases involve teens ages 15 to 19. What is the draw for these teens when it comes to this Benadryl challenge?
I think the main draw is the hallucinogen aspect of it. However, there are so many other negative consequences that can happen.
Dr. Neeta Gupta is a pediatric emergency medicine physician at Children's Minnesota and says symptoms can escalate quickly and within 4 hours. Landing your child right here in the emergency room department, symptoms can go from just confusion to seizures quickly.
The second that the parent knows that their child consumed this is a reason to come in or at least call poison control. Don't even wait for the symptoms to start.
And while symptoms can quickly progress, doctors believe today's conversation can prevent a hospital visit.
I think it's important as parents to talk to your children about social media trends.